I'm Julie. I'll be your student nurse today. We're just going to be changing the dressing on that site. So I'm going to observe the dressing, see if there's any drainage at all, ask the patient if he's having any pain, and then put that in the garbage. And then I'm going to put my clean gloves on while I allow the table to dry. Identify the patient, name and date of birth, check the wristband. So we're going to remove the old dressing with clean gloves and apply the new one with sterile. So we're going to look at the dressing, and we're going to pull it in the opposite way that the catheter was inserted, or the same way the catheter was inserted. So we're going to pull that off. Don't use the scissors, and for ease of removal, you could use an alcohol swab on the outside of the dressing to help with the adhesive. So just peel it off. Don't use scissors because you don't want to risk cutting the catheter. Then you throw that away, remove your gloves. And then we're going to get everything set up over here on that table. And I have a new PosiFlow because we're going to change that, a flush, a bio patch, alcohol pad, and then our dressing change tray. We'll get that out. And then we're going to open up our dressing change kit here. And here's a mask for the patient, so we're going to put that on the patient. You want to ensure that you have a mask as well. And we have our sterile gloves, which I'm just going to put off to the side for now. And then I'm going to prime our PosiFlow here. Mark upside down. Get all the air out of there. Just prime our PosiFlow and keep it in the package. So off to the side. So then we're going to open up our dressing kit here. And then we're going to get the bio patch on there. Okay. Put that in the garbage. Then we are ready to go and put our sterile gloves on. Okay. And then we can get out of the way. And then once we have our sterile gloves on, we can now reach over this sterile field and get what we need. First we're going to have our ChlorPrep, and you're going to want to take that, crack it, clean around the site, and you can go up and down, side to side, all that for 30 seconds. You can go in circles around the site. And then you're going to want to clean the tubing as well. So you can get the top and bottom. And you could put a piece of tape there. There's some tape in here. You could put it on the tubing to stabilize it while you're cleaning, but not necessary always. I'm just watching the clock, 30 seconds. Make sure that tubing is clean. Okay, and then we can allow that to dry. And then, so once that's drying, let's wait for it to dry. And then we would put the shirt and pants dressing, which we don't really have a shirt and pants dressing, we just have a transparent dressing. So we'd put that over the site and just make sure that this is visible through the transparent part of the dressing. But you'd put the shirt and pants on, you put the shirt on and then the pants, and you'd make sure that the tubing is through the little slit. But you'd put the bio patch on first before you put the transparent dressing on. Blue to the sky. and then you put the dressing on. Then you're going to take your PosiFlow that's already primed. Nope. You're gonna leave that in the package. I lied. Leave that in the package. And then you're gonna remove this old PosiFlow. Make sure that this is clamped before you do so. And then you're gonna alcohol off or use a Scrub-A-Hub to make sure. And that's for 15 seconds with friction. I'm watching the clock. Now Scrub-A-Hubs are better for this because you can really get inside of the thing here. But they're not available everywhere you go. Then we're going to take our primed PosiFlow, attach that, aspirate for blood return, unclamp, aspirate for blood return, and then push, pause, flush that. And then when you're done, you're going to alcohol off again. And clamp. And then you'll have a nice clean dressing on there for the patient. And then you document your dressing change. If there was any redness, if you got blood return, what you flushed with, the biopatch that was applied, if you used heparin or normal saline to flush, and yeah, that's it.